our 12th annual Nurse of Distinction Gala, the Grammy Night of the Nurses. Give yourselves a round of applause. This is truly the night for our nurses where we celebrate your good work, your dedication, your caring. There might be lots of things happening, changes within the healthcare industry, but I just ask you to hold on to your steering wheel as you navigate this very ever-changing healthcare industry.
I just want to call special attention to the relationship between the management representatives and 1199 with regard to the nursing division. It's an extraordinary relationship based on trust and based on mutual interest. It's really remarkable in a time of changing healthcare environment that all the success has been realized in this room, and it's because of all of you. I also want to take the time to simply acknowledge the great work that nurses did. You'll be hearing it all night, but all the work that you've done and all the work that you will continue to do makes all the difference in the world.
I know that times are difficult, but when you took that oath, you were committed to be compassionate. You were committed to do all the right things when you step at the bedside for that patient. And that's why we are here this evening to celebrate the work you do and that high quality care from 1199 SCAU. (1199) nurses. We are committed for quality care.
Through the years, I've been able to tell you that I had daughters and that they are, as well as a son, but that they're interested in nursing. And I've told you back and forth that I had a daughter who's a nurse. And tonight I bring proof. You really didn't come here to hear me today or to see me. You came here to see your colleagues that are really deserving of the Nurse of Distinction Awards, and I'm going to get out of the way so that we can take care of the business we came here to do. But thank you on a daily basis for what you do, and it's because of you that Brittany was inspired to become a nurse, and hopefully she will inspire other young people when she gets to be my age to also become nurses and keep that wonderful, honorable profession going.
In 1991, I became president of the League of Voluntary Hospitals. So almost half of my time in New York City has been in this job. And half of that time, almost, we've been having these Nurse of Distinction dinners and celebrating the relationship between the hospitals and nursing homes in which nurses work and the nurses themselves, and recognizing their immense reservoir of skill, compassion, goodwill, and all of the other things that they bring to the bedside and the many places that they work. So I'm always delighted to come to this event to acknowledge that and to be reminded myself, because sometimes what I do is not conducive to understanding how terrific the hospital employees are. So I come to a place like this, I'm reminded that all of the stuff that those of us who kind of stir up the dust and create a little crisis every once in a while and need to be reminded of why we do what we do.
The Novice Nurse of the Year is awarded to a nurse who has worked for 2 years or less in one of our 1199 RN division hospitals. Transitioning into the nurse profession today holds many challenges for new graduates. This award is presented to a nurse who exemplifies a positive attitude, perseverance, and the ability to use critical thinking while focusing on the patient as the center of his or her nursing care.
So, first one, Kirsten Anderson from Mount Sinai Hospital of Queens. Melissa Anderson from Brookdale University Hospital and Medical Center. Wayne Bassey from Eastern Long Island Hospital. Jocelyn Brooks from NYU Langone Medical Center, Hospital of Joint Diseases. Kian Chen from Montefiore Medical Center, Wakefield Division. Anthony D'Annunzio from North Shore LIJ, Forest Hills. Kevin Leahy from Mount Sinai, Beth Israel. Jason Leung from Mount Sinai, Beth Israel, Brooklyn. Vanessa Magloire from New York Community Hospital. Tony Ann Mata from Orange Regional Medical Center. Upinder Multani from Bonsecours Hospital. Steve Prasad from Jamaica Hospital and Medical Center. Natasha Rodriguez from St. Barnabas Hospital. And Christina Smith from Southampton Hospital.
The winner for the 2005 Novice Nurse of the Year is Anthony D'Annunzio.
First of all, I'm very proud to win the 2014 Novice Nurse of the Year. Proud for Forest Hospital. That if nursing is your dream and nursing is your passion, I think you should go for it. Give yourself to the profession. Give yourself to your fellow employees. Give yourself to the hospital you work for. Give yourself to 1199 and all that it stands for. And give yourself to any other opportunities that may come your way, whether it be patient-centered care or being involved in any other labor management initiatives. But give yourself totally. And if you do that, I think that you can be pretty successful in this career.
The Preceptor of the Year is the critical link in retention of new nurses. Essential attributes for the preceptor are understanding and patience, which are utilized as they guide the new nurse towards independence.
Okay, our first nominee for Preceptor of the Year, Cecilia Abagaya from St. Barnabas Hospital. Anne Marie Baker from Brookdale University Hospital and Medical Center. Enid Berg from Orange Regional Medical Center. Hazel Davis Adams from Jamaica Hospital Medical Center. Jennifer Gale from New York Community Hospital. William Hansen from Mount Sinai Beth Israel. Jolette Jean Raymond from Mount Sinai Beth Israel, Brooklyn. Patricia Mance from Good Samaritan Hospital. Dolores McLeod from Mount Sinai Hospital, Queens. Christine Mitchell from Bonsecours Community Hospital. Rosabelle Naleski from Eastern Long Island Hospital. Estella Pasqua from Montefiore Medical Center, Wakefield Division. Alex Pasquale from St. John's Hospital, Episcopal Hospital. Erin Schwartz from NYU Langone Medical Center Hospital for Joint Disease. Cynthia Silvestri from North Shore LIJ Forest Hills Hospital.
The winner for the 2015 Nurse Preceptor Award is Enid Berg.
Always remember to be compassionate and caring. Always remember that every day is a learning experience and to treat your patients as you would treat your own family members.
The nurse leader is a pivotal role essential to recruitment and retention of nurses and promoting quality patient care. The nurse leader must possess leadership skills that demonstrate excellent communication and support for staff, thus promoting team building. Through her dedication to the profession, clinical competence, and inspiration, the nurse leader supports the highest level of patient care.
The first nominee from St. Barnabas Hospital is Verenda Bacalat. From Bon Secours Community Hospital is Janet Bailey. From New York Community Hospital, Ruby Devine. From Orange Regional Medical Center, Nancy Famby. From Southampton Hospital, it's Roberta Griffin. From Jamaica Hospital Center, James Hudson. From Mount Sinai Hospital of Queens, Lily Kanjan Apati. From St. John's Episcopal Hospital, Inumi Kim. From Montefiore Medical Center, Wakefield Division, Marie Morelli. From NYU Langone Medical Center, Hospital for Joint Diseases, Anne Marie Moynihan. From Brookdale University Hospital and Medical Center, Natalie Nicole. From Mount Sinai Beth Israel in Brooklyn, Linda O'Flaherty. From North Shore LIJ, Forest Hills, Kimberly Rushnick. From Good Samaritan Hospital, Marie Vandeveer. And from Mount Sinai Beth Israel, Sherry Weisberg. Please join me in introducing the 2015 Nurse Leader of the Year, James Hudson.
To have a lot of belief in yourself, to stick to the job at hand. It's a process. Becoming a good or a great nurse is a journey, and it's well worth it. You know, if you invest the time into it, invest time into your patients, and invest time into yourself. Always keep the learning process alive.
The healthcare environment in nursing homes today is increasingly complex. Through knowledge, expertise, and critical thinking, the nurse assesses the efficacy of treatment and advocates for the patient. The individual who exemplifies these traits is truly a nurse of distinction.
From the Center for Nursing and Rehabilitation, Keisha Budd. From Isabella, Adriana Isonitis. Shavir Nursing Home, Valerie Jameson. Shulman and Shockney, Jean Joseph. 2015 runner-up, Jean Joseph.
It is a great pride that we announced the 2015 Nursing Home Nurse of Distinction, Keisha Budd.
I have a passion for caring. Ever since I was younger, I knew this is what I wanted to do. I think I was like a teenager, and I was in the doctor's office. And then the doctor come in for 1 second, he leaves, but then the nurse was there, you know, just giving you this comfort, giving you this care. And then I was like, wow, I always did want to be a pediatrician. But then once I saw how the nurse was so passionate for that patient, which was amazing, I said, this is what I want to do because of that bedside, manner.
Nurses practicing in the hospital setting face many challenges, including increasing patient acuity and increased use of technology. Amidst the frenzy of constant change, it is the RN who continues to provide the care and compassion and to promote a culture of patient safety.
The nominees for the Nurse of Distinction 2015 are Carolyn Berry, North Shore, Long Island Jewish, Forest Hills. Engelbert Burton, who is not able to be here tonight, from Brookdale University. Tracy Blum, Orange Regional Medical Center. Marie Jose Cadet, Mount Sinai Beth Israel. Jane Chaco, Jamaica Hospital Medical Center. Editha De Leon, St. Barnabas Hospital. Marietta Gonzalez, New York University Langone Medical Center Hospital for Joint Disease. Rewati Lal, Mount Sinai Beth Israel, Brooklyn. Latoya Murrah, St. John's Episcopal Hospital. Nancy Naughton, Southampton Hospital. Rebecca Pothen, Good Samaritan Hospital. Ronette Shaw, Montefiore Medical Center, Wakefield Division. Colleen Smith, Eastern Long Island. Ketley St. Pré, New York Community Hospital. Don Mati, Sukaram, Mount Sinai Hospital, Queens. Brenda Wolpert, Bon Secures Community Hospital. Since this is the big award, we have a couple of runners-up, and I'm going to introduce the second runner-up. It is our honor to congratulate the 2015 Nurse of Distinction second runner-up, Ronette Shaw.
Join us in congratulating the 2015 Nurse of Distinction first runner-up, Colleen Smith, Eastern Long Island Hospital.
The Nurse of Distinction. This nominee, colleagues, and management staff recognize this individual as extraordinary due to her ongoing exemplifying work, professional values, and attitude. The nominee for NOD 2015 shows outstanding respect for the concept of teamwork and recognizes the value of everyone with whom the nominee encounters, including the patient and family. Driven by passion for improving nursing practice, this nominee believes in higher education, that's right, and empowering patients and family to achieve positive care outcomes and experiences. It is our great honor and privilege to congratulate the 2015 Nurse of Distinction winner, Jane Chaco. Jamaica Hospital.
Thank you so much. It's such an honor to receive this award. Of course, I want to start off by thanking this wonderful organization and union who takes the time to recognize and the hard work that nurses do on a daily basis. I also want to thank Jamaica Hospital, we got 2 tonight, so we're doing something right. But I want to thank all the wonderful nurses, my nurse manager, just for accepting me when I came 5 years ago. I just want to thank you for accepting me, teaching me everything you have taught me, and being wonderful role models. I also want to thank, of course, my family, my parents, and my siblings for supporting me, especially for being nice to me after I was grumpy after night shift. Also, of course, before anything, I want to thank God for being so good to me, not just helping me through my journey as a nurse, but also giving me that passion and that desire to help people and do what I do. When I started as a nurse, I was 21 years old, and I remember coming in and thinking of how insignificant I was. When I walked in through the halls, I realized the doctors did not know me, the managers did not know me, the supervisors did not know me, and especially the CEO definitely did not know me. But regardless of how insignificant I was to the world, I realized the second I stepped into the patient's room, I was very significant. As a nurse, I have the ability to be an advocate for patients. I have the ability to care and show compassion. So I just want to take this time to encourage all of you, regardless of what your position is or where you are, just realize that you can make a difference, you can be the difference, and you are significant. So thank you so much. Thank you. Go Jamaica Hospital!
Wow.